Botox is backfiring for some people. The injection is meant to make wrinkles disappear for a more youthful look, but in some cases, it's making a person appear older. Dr. Brook Jeffy is a dermatologist joining us now to talk more about it. Welcome to Houston's Morning Show, and thank you for being here.
Thank you for having me.
Okay, so we're talking about Gen Z, people as in their early 20s even getting Botox. Have you noticed an increased interest from younger people? And if so, what's going on with that?
I certainly have, and my other colleagues have noticed this as well. In fact, there was a survey last year that showed 15% of Gen Zers are using Botox, higher than any other group. I think it has to do with social media, celebrity, and honestly, seeing our faces a lot more the way we work on Zoom meetings. It's like looking in the mirror constantly and leads to criticism of ourselves.
So I don't think I've ever met anyone in their early 20s who had a wrinkle that looked like it needed help. So what is your thoughts behind this strategy? Could this end up backfiring in the long run?
You know, it really does. I think it detracts patients in their 20s from doing things that would give them more return over the long term in terms of their appearance. So focusing on protecting the skin from the sun, being diligent with their sun care, and focusing on a healthy lifestyle. So their nutrition, avoiding cigarettes, avoiding alcohol. Those are the things that are going to give them a more lasting effect on their appearance versus starting Botox early.
So how could starting it this early actually make a younger person appear older?
So we associate youth with an expressive face. So when a face is paralyzed, you cannot emote in any way, it makes you look older. The other thing is that with longer term use, muscles atrophy with age. And so if we are constantly paralyzing a muscle, that contributes to that. So you imagine a time when someone has used Botox for many years where, for example, they can't lift their brow anymore because their forehead muscle has atrophied and they can't show any emotion by moving their brows. So there are many factors that can kind of contribute to a more aged appearance if Botox is not done properly and utilized properly.
Well, and I'm wondering if at some point, have you ever had to tell someone, no, I really don't feel like you need this? You might want to suggest something else to them, because it seems like if your doctor's just like, sure, we'll go for it, and there's nothing there to begin with. It seems like that's not very ethical, to be honest.
It's true. Yes, I try to deter patients when I feel like there's really not any wrinkle to be seen. I have told patients no when they move their face and there's nothing to see. But there is this trend out there of wanting preventative Botox, so it does come up a lot. And you're right, there are people who will do it anyway, but I always have a discussion with my patients about other things they should be thinking about when the appropriate time is. But it is a personalized decision, and a patient should feel comfortable with their injector.
All right, Dr. Brook Jeffy, thank you for taking time to talk to us. Interesting conversation. I really didn't understand or realize that this was a trend, and now we know. Hopefully we've raised some important awareness about it as well. Thanks again.
Thank you.